Welcome to Wednesday's edition of COVID-19. Korea's daily tally has surged past the 2,000 mark yet again. Accordingly, authorities are calling on members of the public to abide by prevention measures and to seek inoculation. Now, speaking of the latter, debate continues over the legality of vaccine mandates, and we have details on this later on in the program. Here first is our Kwon So-ah with the broader pandemic coverage. So, just start us off.
Well, Sunny, it is the fourth time that Korea is seeing more than 2,000 daily COVID-19 infections, and 2,155 is the second highest ever caseload that we are seeing here in the country. And that includes 2,114 domestic transmissions and 41 cases from abroad. The capital Seoul has also hit its all-time high with 677 infections, followed by 587 in Gyeonggi-do province. Also triple digits in Daegu and Gyeongsangnam-do province. Now, meanwhile, in Jeollabuk-do province, there's also been a rise recently. And here, the city of Jeonju has announced that it will implement level 4 social distancing measures beginning on the 27th, which would be Friday. And that would be the first time that such high measures will be implemented in Jeollabuk-do province. Now, for weeks and weeks, infections are lingering at above 1,000, as you can see here. In fact, this Wednesday marks the 50th straight day that we are seeing a 4-digit figure of daily infections. And if we take a closer look at the Wednesday figures since late July, we are 66 cases short of the all-time high that we had on August 11th. And the total number of cases in Korea with that stands at 241,439. We've got 9 additional fatalities. And also there's been another record high of patients that are currently under severe or critical condition at 434. So breaking the record for the second straight day. And despite the prolonged implementation of strict social distancing measures, numbers are showing no signs of slowing down, and especially the Delta variant is being blamed for this trend. So Prime Minister Kim Boo-kyum noted that Delta infections recently accounted for 9 out of 10 cases, stressing the current wave of the virus is a completely different challenge.
According to the KDCA's analysis of some 24,000 domestic cases, Delta variant patients may carry viral loads that are more than 300 times higher than the original strain from the early stages of infection. It has a frightening ability to spread. As we have observed in many other countries, letting our guards down even slightly can lead to an explosive spread.
Right, and since prevention is better than cure, so I understand authorities are working to ensure safety during the upcoming Chuseok holidays.
That's right, Sunny. With less than a month left until the autumn harvest holiday, the government is expected to announce special antivirus measures for the 5-day holiday, which includes the weekend. So that is expected next week. But what an official at the Health Ministry did announce this Wednesday already is that the country's reservation for bullet trains are scheduled to open beginning on the last day of August, and that only window side seats will be sold at first to decrease the chance of infections within trains. The measure was also implemented during last year's Chuseok holiday, with so far not a single COVID-19 infection having occurred inside trains. The question for many, though, is whether getting together with families and relatives living in other cities will be possible, with officials saying that needs more monitoring of the virus situation, but did leave some room open for gatherings, as 70% of the nation's population is expected to have been vaccinated with at least 1 dose by Chuseok. And so far, we have 52% who got that first shot at least, and around half of that have been fully vaccinated. Meanwhile, we will also have regular citizens aged 18 to 49 inoculated beginning tomorrow on Thursday. And reservations will also continue for that age group until the 18th of September. Over in Israel now, health officials say that rates of infection and severe illness have been going down ever since the country has started to administer booster shots for its population just less than a month ago, and being the first country to do so. Now, in the U.S., a recent CDC study found vaccine effectiveness, which was at around 91% before the Delta variant became the dominant strain in the U.S., has now declined to around 66%. So all of these recent studies will probably initiate further debates on whether booster shots are needed amid the spread of the Delta variant. And now let's take a look at some figures abroad. The U.S. currently with 38.9 million infections, as I said, is struggling with resurgences due to the Delta variant. Then we've got Colombia here with almost 4.9 million infections. Colombia has its president here in Korea for its first state visit to a country outside Latin America, with the two countries having promised more cooperation for the after COVID-19 era. We've also got Indonesia here with a slowdown in cases, but now having surpassed the 4 million mark in total infections. And the total number of cases around the globe now stands at 213.9 million, with almost 700,000 cases reported in the past 24 hours as of noon Korea time. And those are the updates that I have for now. Back to you, Sunny.
All right, so as always, thank you for that. I'll see you on Thursday.
See you.
Right, shifting gears now, efforts continue to understand the origin of the coronavirus, and our G. Abby Lee joins me in the studio with details on that. G, welcome.
Hi, Sunny. So come December, it will be 2 years since we saw the first case of COVID-19, but unfortunately, we still know very little about what happened in those early days of the pandemic. In today's segment, let's delve into the ongoing discussion on the origin of COVID-19, beginning with a statement from the White House Press Secretary, Jen Psaki. During Monday's briefing, Secretary Psaki said a review of the origins of COVID-19 will conclude on Tuesday, but it could take several more days before the findings are declassified and made public. Back in May, U.S. President Joe Biden tasked the intelligence community with a 90-day probe on 2 possible scenarios of how the virus first broke out. Citing 2 senior U.S. officials, the Washington Post reported Tuesday night local time that the new assessment by U.S. spy agencies didn't yield a definitive conclusion, in part because of the lack of information from China. One of the officials told the Daily, if China is not going to give access to certain data sets, you are never really going to know. I
see. Meanwhile, I understand there are 2 scenarios that authorities in the U.S. are talking about with regard to how the virus was,
Yes. So the first scenario is the one where a virus from animals crossed into humans, and the second scenario is where a man-made virus is leaked from the Wuhan lab. As for perception at the beginning of the pandemic, based on the limited access that scientists had to Wuhan, many thought COVID-19 emerged naturally. That is a conclusion the World Health Organization in Beijing had reached. Since then, a string of renowned scientists admitted they may have rushed to the conclusion. Also this year, a report from the U.S. State Department showed employees of the Wuhan lab were becoming sick with COVID-like symptoms in the fall of 2019.
Right, the autumn of 2019. Now, I also believe a recent publication by the Wall Street Journal served to add fuel to fire. G, could you tell us about that?
That's right. So in an opinion piece titled, "The World Needs to Know What Happened at the Wuhan Lab," Drs. Robert Redfield and Mark Siegel said China had invited suspicion by refusing to allow the U.S. CDC to visit the city of Wuhan or the Wuhan Institute of Virology in early 2020. Some of the points they raised are: why were the coronavirus bat sequences deleted from the Institute's database on September 12, 2019? And why did the lab request some $600,000 for a new ventilation system? They also pointed out that COVID-19 is unlike the other coronaviruses, such as SARS and MERS, which emerged from bats and spread through an intermediate host. Neither of those viruses ever evolved to transmit efficiently from one human to another. In total, they each led to fewer than 10,000 cases worldwide since SARS was first discovered in 2003 and MERS in 2012. COVID-19, on the other hand, has killed 4.5 million people so far around the globe. Redfield, who is the former CDC director, said it's not biologically plausible for a virus to come out of a bat cave and infect humans by the millions. And if the virus slowly evolved over many years in the wild, it's very difficult for it to go unnoticed by humans.
I see. Now, I'm assuming, G, these words by Redfield were not well received by Beijing.
Not very well. So the Chinese Foreign Ministry on Tuesday mirrored its American counterpart and urged Washington to invite WHO experts for an origins probe in the U.S.
We urge the United States to stop the clumsy trick of shifting blame to smear and denigrate China, disclose and test data of early cases at home as soon as possible, and invite WHO experts to conduct origins research in the United States as soon as possible.
Wang's remarks come amid speculation that the first case of COVID-19 in the U.S. could have happened before January 2020, the official time frame issued by Washington. He claimed the U.S. has been reticent and elusive in its own origins research, while accusing China of lacking transparency. Wang doubled down and said since China has already invited WHO for origin tracing twice, the United States should do the same as quickly as possible. Less than 2 weeks ago, Beijing rejected the WHO's calls for a renewed probe into the origins of COVID-19. A team of international experts went to Wuhan in January this year to produce a Phase 1 report. It was written in conjunction with their Chinese counterparts and failed to conclude on how the pandemic began. That's all from me today. I'll be back same time next week.
All right, as always, thank you very much for the coverage.
Thanks for having me.
Right, elsewhere, a deadly earthquake struck Haiti in mid-August, killing 2,000 people, more than 2,000 that is, and hurting more than 12,000. Search and rescue efforts were hampered by a hurricane a few days later, and now relief workers are reportedly warning of disease outbreaks. For more on the situation there, I have Sean Rubens, Jean Sacre, live on the line. Sean, welcome.
Thank you for having me.
Now, Sean, it's been about 10 days since the devastating quake there. What can you tell us about the rescue and relief efforts currently underway?
Well, I can inform you about 8 days ago, which is 2 days ago on Sunday, that the civil protection were able to rescue about 24 people under the rubble. That's about a week after the earthquake. So that is an ongoing process right now that they're still trying to rescue people that is still stuck under the rubbles. And it is a very difficult situation. Right now, this is the process that they're going through. There is, and they're trying as best that they could bring food and water and medical supplies to those people that are have been going through that difficult situation at this moment.
Right. Sean, thousands of people have been killed, injured and displaced. How are these victims coping with this latest crisis?
As for now, the resulting of the earthquake of 7.2 that shook Haiti and the 14th of August 2021, which left many people, about 700,000 people are homeless right now. And we have approximately 400 people that were killed by the earthquake. And the situation, it's very, very difficult at this moment as they're going through it. Therefore, it is huge difficulties where shelters is not accessible to those people. And we have the local government and then the local NGOs that they're trying their very best to bring the support relief to those people at this moment. And it is, to tell you, it is a very, very difficult situation that those people are going through at this moment. And Lekai, the south part of Haiti, and southwest Haiti, and southwest of the country. We also have international support that is coming to them, trying to support them. And we have, as Haiti is community bound, And we have the community that cope together and trying their very best to bring the support to those people.
Right. Sean, back in 2010, a disastrous quake earlier that year led to a frightening outbreak of cholera in Haiti. Now, here there are alarming forecasts about a potential repeat of that scenario, one that can be further aggravated by the current presence of COVID-19. What are your thoughts?
Back in 2010, when the cholera breaks out, I was one of the journalists that was able to do some research concerning that, which was the Nepalians, UN soldiers that spread out the virus in Haiti at that moment. But at this time, I can emphasize that the COVID-19 is not actually a big issue in Haiti. Haitians believe they are a greater issue to deal with than the cholera, than the COVID-19. It happened approximately about, let's say, less than a month ago, that 500,000 of vaccine were donated to Haiti by the U.S. Government. And it was being distributed through COVAX. And then it was then immediately starting to distribute it in selected hospitals in Haiti. And then that we're having some people that are starting to getting vaccinated, which are not many, and is not as an ongoing communication, a mass communication, I would say, as it is happening in the west part of the world and other countries, contrary to Haiti. But still, people are still wearing masks because it is recommended to wear masks in government institution offices, businesses, and supermarkets. But the informal market, what we will call local markets in Haiti, people are not wearing masks at all, and which is cholera, as it appears. Sorry, I'm mentioning cholera. COVID-19 does not appear as a major issue in Haiti at this moment.
Right. And Sean, now, as you mentioned, foreign aid, including that from Korea, is trickling into the country. But I understand that reaching those in need is proving to be quite challenging. Could you tell us more about that?
Haiti have been receiving aid from many other countries. It's including the U.S. and Canada, France, and European Union, Venezuela, and Cuba. Cuban doctors that plays a major role on medical services in Haiti. And it is a very, very, very difficult situation that those people are going through. And I believe that this is the great moment that Haiti could gain the opportunity, to seize the opportunity to bring the country together and hopefully that they could depend on themselves and not able to continue and depend on other countries' aid, and that they could do something for themselves in the future.
Right. One final question, Sean, before you go. Now, Haiti appears to have been hit with one tragedy after another, including last month's assassination of President Jovenel Moïse and this month's natural calamities, as well as the potential onslaught of diseases. Sean, how are authorities in Haiti there responding?
The authorities, since the world understands and that Haiti is a poor country and unable to support themselves. And we have a small amount of support of our own to respond to those kind of problems. And that's the main reasons why we depend on other countries. And after the assassination, people in Haiti were not waiting, expecting for that, what is happening today to happen. And they're just waiting with patience because there is an ongoing investigation at this moment after the assassination of the president. They're waiting on with patience, and then they listen to the government, which asked them to stay calm and then to see what will be unfold after it all happened.
I see. All right, John, thank you for being with us live from Haiti, and do take care.
Thank you very much for having me.
Right, back on the local front, amid the prolonged pandemic here, face masks have become an indispensable part of everyday life. We have more in this next report.
One of the most noticeable changes the pandemic has brought is a mask mandate. In fact, Koreans have a high awareness of wearing masks.
이제 마스크 없으면은 아무 데도 갈 수 없고 이제는 몸과 하나가 된 거죠.
According to the COVID-19 perception survey, 97.3% of Korean adults said they were complying with the mandate, and 90.2% responded that others are following the rule very well too. Furthermore, according to a survey, about 30% of the respondents said they believe they would wear masks even after the pandemic.
If you can't avoid it, enjoy it. We can definitely relate this famous saying to the current situation where wearing a face mask has become the new normal. Well, face masks, they were initially part of our preventive measures to fight against the pandemic, though. As it prolongs, now they act as fashion accessories.
The store, which opened in January this year, sells a selection of face masks with colorful designs and patterns like flowers and marble. Also, you can choose mask types such as surgical or KF94.
저희 매장은 코로나가 장기화되면서 마스크가 일상화가 됐고 이제 사람들이 흰색, 검정색 마스크만 쓰는 게 조금 아쉬워서 조금 더 즐겁게 쓰는 방법이 뭐가 있을까 하다가 런칭을 시작하게 됐습니다.
다들 마스크를 쓰고 다니니까 좀 개성도 살리고 싶고 하얀 색깔 마스크 쓰면은 막 기미가 생긴다고 얘기도 들어가지고 좀 미용적인 목적으로도 찾게 되는 것 같아요.
Mask-related accessories are also being worn by many people. Not only masks, but also straps that have gained much popularity recently can be found here.
This is the mask guard, which will allow you to breathe well because it gives you some space between your face and the mask. I personally own this one, and it's really helpful in a way that I can breathe better than without this one. And this is ear loop buckles. Using this one, you can adjust the size of the face masks. And this is called antibacterial patch. At times, you can just smell bad breath inside the mask because you have to wear it all the time and you can't really brush your teeth every time after the meals. So at that time, you will find it useful in a way that it can get rid of all the bad odors inside the face mask. So like this, you can find tons of different kinds of face mask accessories that you can use with a mask.
What's more, from fabric to silicone to lace, we have a more diverse mask material selection, and mask decorating has gone viral too. Also, we can find many mask brands with commercials with celebrities, and some luxury brands are launching their own face masks.
Masks has become a common fashion trend though. Wearing them every day has both its upside and downside.
On the upside, the use of masks has reduced the risk of respiratory virus infection. The number of patients treated for respiratory diseases in 2020 when the pandemic broke out decreased by nearly half compared to the year before. On the downside, the survey found that 7 out of 10 daycare center instructors believe that face masks have affected language development in children. It also reduces emotion recognition. According to an experiment conducted in the US, while people were 100% accurate in reading their counterparts' emotions, it was dropped to 66% when their counterparts were wearing face masks. Despite those negative effects, masks are deemed crucial as they reduce the risk of infection by 85%.
적어도 올해는 이 코로나19 때문에라도 마스크 착용은 계속 하게 될 것 같고요. 또 새로운 면체들이 계속 등장하게 될 거거든요. 그런 상황이 올 때마다 마스크의 중요성은 또 한 번 부각이 될 겁니다.
Given that face masks are playing a crucial role in the battle against the pandemic, they are expected to grow in popularity for a while. This has been 신새벽.
Nous avons choisi de mettre le pass sanitaire en œuvre sur les TGV, les intercités et les trains de nuit.
So now that the Pfizer vaccine has been approved, the department is prepared to issue updated guidance requiring all service members to be vaccinated.
À partir de lundi, il y a des grèves dans les hôpitaux, chez les pompiers, chez tous les gens qui veulent. Et on va faire un boycott, c'est-à-dire plus de restaurants, on va les prendre par la bourse, parce que c'est comme ça qu'on...
In today's studio session, we weigh in on the morality and legality of COVID-19 vaccine mandates as countries seek to raise public protection against the pandemic. Now, here in the studio, I have Professor Yu Byung-wook from Suncheon University. Welcome back, Professor Yu. And I also have Professor Cho Hee-kyung from Hongik University. It's good to see you again, Professor Cho.
Good to see you too.
And joining this session virtually is Professor Peter Newman at the University of Toronto. Pleasure to have you with us, Professor Newman.
Thanks for having me.
Professor Yu, we'll start here in the studio then. Earlier this week, the US FDA gave full approval to Pfizer's COVID-19 vaccine. Let's start then with the difference between an emergency use authorization and a full approval.
Well, emergency use authorization is under the war situation. Pandemic COVID-19 mean we are fight against the new arrival virus to fight against to save the human beings in the earth. That's why usually the vaccinations it will invent it need to use at least 18 years, not 18 months. But actually, we used under the EUA, the emergency use approval, only 12 months and 18 months. But last 8 months in the US, in the United Territory of the United States, and the European some countries, Turkey and South Africa, so American FDA, they did invest the safeties, efficacies about the Pfizer vaccination with the 44,000 people are. So their efficacies was under the EUA, 94% of the efficiency of Pfizer, but final approval with the 91%, but the safeties and other one is approved as like aspirin, you mean? Aspirin for use for everybody's because under the full authority. That's why we can buy and the pharmacological company, they can advertising and selling. So now is the commodities, the name of the Pfizer one, can start as like advertising and selling to private part in the hospital.
Right. Now, Professor Cho, the belief is that such full approval by authorities looks to pave the path for COVID-19 inoculation mandates. What are your thoughts?
Certainly having this full approval rather than just an emergency approval is going to help the government's argument if they actually want to introduce a vaccine mandate. But I think it would be quite difficult to introduce a general blanket mandate at this point in time. particularly in countries like the US, UK, where civil liberties are very strongly protected. You always have to weigh the breaches and infringement of personal freedoms as opposed to the risk to collective and public health. And so this particular change recently, the full approval, is not just going to pave the way, but it would help the government's cause if they were really set on introducing a mandate.
Right. And over in Canada, Professor Newman, vaccine mandates have been declared by federal and provincial governments, private businesses and banks for their workers. Could you start by elaborating on this for us?
Yes. So as in the U.S., there are federal mandates for federal workers. In Canada, in addition, now, as you know, there are mandates in terms of for airline travel, for rail travel. And certainly in Canada, there are some mandates understandably, for workers in care homes for older people who are obviously at the highest risk. And that's certainly in Ontario, where I was located, in other places in Canada, where the harshest outbreaks occurred at the beginning of the pandemic. So those seem like rational, targeted uses of a mandate, and I think that should be put in with some seeing the differences between that and a kind of blanket mandate, just as the other speaker was discussing.
Professor Cho was saying, right?
Further. Yeah.
Right. Professor Newman, what has been the public response to these vaccine mandates over in Canada?
So here's what I can say. So interestingly, they're really not yet. So these mandates, otherwise, I don't know if you want, passports are not the same as mandates, right? And so that there are some passports in British Columbia. We'll be starting it in a few weeks. Quebec is talking about it, or may have started to implement it. Those are for non-essential services. So that's, it's along a spectrum of requiring vaccination, but you don't have to go to the movies, right? And you don't have to eat inside a restaurant. So, if you choose not to get vaccinated for whatever reason, you're going to lose out on some of those goods. But it's not the same as saying you're required to have a vaccine to be able to get into a hospital, for example, if you're having a heart attack. That much more draconian measure. By and large, there's public support because, first of all, Canada has one of the highest rates of vaccination in the world. So we can't know this for sure, but we do know that about 73% of the Canadian public over 12 years old are vaccinated. And there is about 73 or 74% support through surveys for some forms of requiring vaccination. Now, those two numbers probably don't, we can't assume those are the exact same people, but I bet you we can assume that there are a lot of people who are among the people supporting the mandates who've already had the vaccine. And my problem in terms of potentially going too far too soon with the mandate is what we're interested in now is the other 25%, right? And if those 25% are going to feel further polarized, and as the speaker said before, in terms of this kind of entitlement to certain liberties, they may be pushed further against getting vaccinated. Whereas if a kind of softer, more targeted, more thoughtful policy was implemented first, perhaps we would win a number of that 25% over. Just let's say, but I'm not talking about workers in nursing homes. If my mom is in that nursing home, believe me, you better have your workers. That's a very, very high risk situation. So that's a targeted issue. But in terms of to be able to go out to dinner and things like that, well, that's not a mandate, and you can don't go out to dinner if you want to wait to get your vaccine.
Right. Now, staying with public response, Professor Yu, based on your observations as a doctor here, what appears to be our public sentiment to COVID-19 vaccinations as compared to that elsewhere?
Well, so the vaccine pass and this regulation, personally, I don't want to ask everyone to have this because it can be restricted to some publics and the freedom and the, like a human being and the dignity as like the humans. But you know, we did already. When you're traveling to some African countries and the middle of the Central America, you have to have the yellow fever vaccination. Not only for you, for everybody. If you do not got it, they got the fever, so the yellow fever vaccination card, if you don't have it, these are not permitted. You cannot go to anywhere in some African countries. So anyone, any other sample, so everybody in Korea, they have the children when you take care of them, before they go to the elementary school, we have to submit the elementary school for the vaccine record for the children, especially for MMR, measles, mumps, rubella, and the chickenpox, not for only your child, and for everybody. So this kind of, how to say, silence procedures, we are accepted already because we not recognize, we never resisted. But anyway, but if we use this vaccine pass for certain circumstance, we need more discussed to accept in general.
Right. Now, Professor Cho, as Professor Yu has mentioned, there are current mandatory vaccination laws like that for yellow fever, measles for children, etc. What makes a potential vaccine mandate for COVID-19 so different then?
I would say that it's actually not that different to existing vaccine mandates. So we have vaccine mandates, as Professor Kim, you mentioned, for lots of diseases, especially for childhood. Under the age of 59 months, you have like a dozen different vaccinations that you have to have. He mentioned MMR, but there's also smallpox, polio, tuberculosis, hepatitis A and B, tetanus, all sorts of things. And these are all mandatory. And I would also argue that this biannual health checkup that we have to have if you're an employee is also a kind of a mandatory, health examination that the government is subjecting us to, because although it's strictly not illegal not to have it, you have to pay a fine of 3 million won if you're an employee if you refuse to get that health check, and the employer may be liable for up to 10 million won. So that's effectively a mandate, right? So with vaccine mandate, the question is, what's the risk of this posing as a danger to the general population, as opposed to how much does it infringe your own personal freedoms? Because this is really essentially a clash or a tension between two basic freedoms. We all have a right to bodily integrity. We can object to having my body injected with some foreign fluid, which is what vaccination is, if I don't want to. But then the question becomes, how much of a risk or a danger do I pose to the rest of the population if I don't do that? So as the Canadian guest mentioned, if you are working in a high-risk environment like nursing homes, in hospitals, here in Korea also healthcare workers were the first ones to be mandated for vaccination, as well as other people who are working in a very collective environment. But if you are happy to just stay at home for the rest of how long ever this pandemic is going to last, never venture out, never socialize, then by all means don't have a vaccination. So I think it's a question of what's the risk, how much leeway can we give to individuals, as opposed to what the government has to do to protect the general health.
Right. And Professor Newman, simply speaking, what are the implications of vaccine mandates on public health?
My concern in terms of the implications are, as Professor Kim has talked about in terms of, and Cho as well, right? There's a different, so parents have to make decisions about their children's becoming vaccinated. And there have certainly been some backlash and pockets in the US that I'm aware of, and where there's actually been outbreaks of like malaria, in the middle of nowhere, where we thought that disease was basically eradicated because people weren't getting their kids vaccinated. But by and large, people accept childhood vaccination. My challenge is with adolescents who are of age, because I do some work in terms of universities, and with adults, there's obviously decision-making involved. And my main concern, I'm very pro-vaccination. I'm vaccinated. But my concern is that something that's already extremely polarized. And that has to do with the past US administration. Unfortunately, that was pretty much the worst situation we could have faced, having a pandemic occur with a fairly incompetent administration. This is now changing under Biden, but those sentiments don't change so quickly. So this has already become so politicized that I think we should be cautious. And in a public health approach, a first stage is ensuring access. Let's make sure everyone has access, including marginalized populations who are actually at highest risk for COVID. And this has not been the case all over the U.S. and in Canada. Now it's more, but some of those folks have had less time to become vaccinated. Then let's do promotion, targeted promotion. And targeted promotion means that I respect that some communities that have been wronged in the past by the federal government and that have not always been treated with integrity and as if they had control over their bodies and minds, their distrust is very rational. That's not crazy anti-vaxxer. That's a very rational concern, and they should be approached with respect. So that's promotion. Incentives are what we're doing now in terms of these, as I see it, these passports. You don't have to eat in a restaurant. You want to? Well, get a vaccine. You want to go travel across the country? Canada is a large country. That's a 4-hour flight, whatever. Get a vaccine. Mandates are the last stage, and when these other measures don't work. And my feeling is, from a public health perspective, and we've learned this in dealing with other risk situations like HIV, like drug use, that going in with a sledgehammer and with the most force immediately is often not a very effective way in, because you end up pushing people away who you might otherwise convince to take the next step in reducing harm to themselves and to other people.
Right. Now that is understood, of course. Professor Yu, apart from certain professions like nursing homes that Professor Cho and Professor Newman mentioned, are there specific groups of people that you believe need to be required to be vaccinated?
Yeah, absolutely. Not only the health providers, at the same time in the elementary and the high and the public schools and the teachers and the staffs. Also all the government officers, they should be done because they are facing all the people who need the service. So otherwise, and the ships and airline service as well, and the public transport, we can highly consider about it.
Right. And Professor Cho, a new campaign appears to be taking root over in the West and down in Australia as well. What are your thoughts on the no jab, no job movement?
So this is one aspect where I would say that the COVID vaccination is perhaps slightly different to other vaccinations, because if employers and companies are going to actually start introducing private mandates to their employees and say, you all have to come back to the office by a certain date, but before you can come back, you have to be vaccinated. And you, for whatever reason, it could be health reasons, it could be personal reasons, whatever ground you might have, you might say, actually, no, I don't want to be vaccinated. But if you have been, up until now, able to do your job perfectly well from home, working remotely, but then the company says you have to be back in the office and you have to be vaccinated, otherwise you can't come back and you will lose your job, then that's really a real predicament, and that can amount to discrimination. So in countries like UK and parts of US, there have been warnings by the Equal Opportunity and Human Rights Commissions to the employers to say that you cannot force employees to be vaccinated as a condition of their being able to come back to work. And so that's a sort of a dangerous ground, I think, for employers. And so this no jab, no job might sound, logical and reasonable, but when you actually delve into the nitty-gritty, it could be discriminatory and it could actually amount to constructive dismissal for some workers.
Right. Professor Newman, as you mentioned earlier, Canada has mandated COVID-19 vaccination for bureaucrats as well as transportation workers. But Professor, you also mentioned the importance of having essential workers like the teaching staff also vaccinated. Have they been included in the mandate?
Okay, I mean, I didn't mention that, but certainly, as I'm aware of now, there are not mandates, and the universities it's changing almost on a daily basis. The wave of universities who mandated vaccines for all staff and students is much greater in the U.S. I mean, of course, there's a lot more universities there. But from the Canadian scene, there are some universities and there's movements towards mandates, but the law professor might have a better word for it. They're kind of soft mandates, like you must get a vaccine to be on campus or else you have to be tested every couple of days, so that there are loopholes for someone who adamantly refuses to become vaccinated. And then, of course, there are some people who can't be vaccinated because it's dangerous or who are immunocompromised and for whom the vaccine doesn't work. I mean, that's a very, very small percentage, but we do need to accommodate those folks. That is becoming, more and more polarized in Canada. And I also feel like we've been operating on Zoom, teaching classes online for much of the last year. And now with, I think, close to 70%, with 50% of students fully vaccinated, the age range of 18 to 29, they had access later because they're younger. I mean, understandably, give them a little time to become fully vaccinated. They've already had one dose. It's not likely that they're suddenly going to become highly hesitant on the second dose.
Right.
And I think we'll achieve a fairly high percentage without kind of too strong measures. But it's
hopefully
changing.
that will be the case, Professor Newman. All right,
Yes.
Professor, thank you so much for your insights. Professor, you're here in the studio. Thank you very much for your thoughts today. And Professor Joe, always a pleasure to have you with us.
Thank you.
Right, while incentives for inoculations are largely understood, penalties against people who choose not to be vaccinated are bound to fuel many legal and moral debates. Hopefully, constructive public discourse on the matter will lead to a tangible consensus. Thank you for watching.